Dr. Aruna Radhakrishna to talk on newer trends in amblyopia management. So we'll have the questions at the end. எல்லாருக்கும் மாற்றி மாற்றி நம்ம கொஷின் கேட்டுடலாம் சரிங்களா ஃபர்ஸ்ட் நீங்கள் ஆர்பியோட கொஷின் சார் கிட்ட கேளுங்க அடுத்தது
let's have a look at the newer trends amblyopia and preferred practice guidelines for the same. So though amblyopia research has been dated as early as 1700s and has been constantly evolving, until recent years conventional patching therapies were the only option available, and as you all know it has its own limitations. So like what happens when conventional patching therapy is done, as you can see in this picture, there is only a quantitative improvement of vision, but there is a false orientation in this, as you see in the second picture, and there is no binocularity. There's a false orientation of the image. So that's the main limitation, because we all know that it's a binocular vision disorder. So then came, with the recent advances came the newer vision therapies. These therapies were based on two learning concepts, perceptual learning and dichoptic training. So perceptual learning was defined by Eleanor Gibson in 1963 as an experienced dependent enhancement of our ability to make sense of what we see, hear, feel, taste or smell. And these are some other forms of perceptual learning for other senses. So coming to perceptual visual learning, it's a repeated challenging visual task which is done with Gabor's patches, and it increases the visual threshold acuity levels, and as the difficulty of the tasks increase, and this strengthens the neural connections and rewires the connections in the brain and leads to visual improvement. So the next is the dichoptic training. The basis for this is we all know that amblyopia is a binocular visual dysfunction with monocular deficits, and suppression is the main gating mechanism here. So the aims of dichoptic therapy are to eliminate suppression in the first line and to strengthen fusion and restore the binocularity of. So this is the eye which is treated with the binocular newer active vision therapies. You can see there is a improvement of the visual acuity, and there is a true orientation and restoration of binocular vision. So coming to whom to consider for these active vision therapies, all types of amblyopes can be considered, but the functional refractive amblyopes, they have a good prognosis. Some therapies do work for organic causes of amblyopia. And age groups 5 years and above are ideal candidates for these therapies. However, children as early as 4 years can, if they are able to perform these software-based therapies, then they can be taken up. And visual acuity, again, it's 5/60 or better, but some therapies do work even for lower vision patients, and it can be customized as per their needs. So for going into this vision therapy, a comprehensive eye evaluation has to be done, which is like vision and refraction has to be done, a motor and sensory evaluation, and of course an anterior and posterior segment examination to rule out any active pathologies happening there. So, and most of these therapies require a foveal fixation. It can be done either with an ophthalmoscope or a OCT image. So based on the literature and our own experience, the preferred practice for these new therapies is, first you have to accurately diagnose an amblyopia and classify them, whether it's a functional or an organic amblyopia, because treatment varies between the two. If it's a functional, we all know you have to treat all the amblyogenic factors and give them the best optical correction where possible. And in functional, there are two therapies, as we already saw. It's a perceptual learning based therapy or a dichoptic training. Both can be given customized to on the patient basis. And for organic, like low vision patients, we can give a try of perceptual learning programs. And we of course, for all this, we have to monitor during the therapy, reassess, and follow-up of the patient is very important. So just have a look at the software options. Revital Vision is a perceptual learning-based program, which can be done both for organic and functional amblyopes. And Binox is a dichoptic anti-suppression software. It's a user-friendly software, and it it works well with all amblyopes, especially refractive amblyopes. So Vishwa Prime is another by Shankara team, which has a home edition and a professional edition, where the patients can perform at the office. And then this is again a dichoptic anti-suppression based. So the other VR-based and mobile-based therapies are DIGRUSH, VTSO4, and Vivid Vision and Pauling blocks. So the take-home message is you have to identify amblyopia and you have to customize the treatment regime for each patient and monitor them during the therapy, assess the endpoint, the duration of therapy, reassess and reevaluate them, and follow up of these patients. And these are all the guidelines, but it has to be updated regularly, and we have to take this only as a guidelines, and on basis of each patient, we have to customize the treatment options. So newer therapies are desirable and should be encouraged. However, needs regular updation. And thank you. Thanks for